Hello, everyone. My name is Nail Desai, and uh, I'm going to be talking about a medication known as Pluvicto, um, specifically a cancer treatment medication for advanced form of prostate cancer. This medication was recently approved by FDA, so I just like to briefly talk about a little bit about it. Um, so. What is it? What do we, when we think of cancer, what do we think about? Well, if you look at um, this slide here, first of all, before we even talk about cancer, this medication itself, you can see in the chemical name, lutetium Lu-177. That sounds more like a um, radioactive type of medication. So it obviously has to do something with a cancer type of medication. Cancer essentially is where there's an abnormal growth of cells. And whenever um, abnormal growth occurs, it continues to spread. It can damage organs, damage other parts of the body. So medications like this is used to treat and prevent the abnormal continuous growth of these cells. Um, so in the process, we're about to talk about the mechanism to help treat it. In other words, in this definition here, it is a type of radioligand therapy for advanced prostate cancer, specifically PSMA, which is prostate metastatic castration resistant prostate cancer. Now, what does that mean? Essentially, it is when a patient has this type of um, well, PSMA, excuse me, is basically a signal for or a marker that the drug is going to target on the cancer cell. So when patient has a positive metastatic castration resistant prostate cancer, basically castration resistant is for when a patient has when a when a type of cancer forms regardless of whatever hormone therapy is used to lower that amount. So it just it's just resistant to any type of hormone therapy, essentially. It just continuous growth of the cancer cell. So this medication is going to specifically target the PSMA markers that are special proteins expressed on these cancer cells. And when they connect, it's going to release the beta particles and damage the DNA processes and parts of the cell so that it can destroy the cell altogether, at least the cancer cell specifically, without interfering or causing damage around the other area. So it's pretty interesting. So as you'll see here, let's talk about prostate cancer mechanism first. So first, when um, before cancer develops, there has to be some sort of DNA mutations that will occur. And this DNA is essentially useful when it comes to cell growth, DNA repair, destruction, renewal of the cells, and all of that. But when there's mutation, it just causes abnormal amount of cell growth. And all of those things get damaged, do not work, and destruction doesn't really happen as it should normally. So instead of destroying the cell, abnormal prostate cells continue dividing, and then the tumor forms, and then with the help of testosterone and other androgens, it will help fuel growth of these cells and allows cancer cells to continue growing. So that's how it becomes like I guess in a way castration resistant. It's going to continue to grow, whether it's low or high. It doesn't matter how much testosterone the patient may have. This cancer will continue to grow, and spreading or metastasis of the cancer cells to other places such as bones, lymph nodes, liver, lungs may occur. If untreated, left untreated, becomes more advanced, then it's going to continue to spread to other parts of body. And then, so to prevent all of this from occurring, um, there's a protein called PSMA, which is prostate specific membrane antigens. And these proteins are located within the cell. It allows the target for Pluvicto. And then it's given normally as an IV treatment, acts like a target mark. PSMA acts like a target marker. So it's going to attach PSMA to radioactive lutetium 177 selectively, and then it's going to pull the Pluvicto molecule inside, like you see in the picture here, um, and then release the beta particles and damage the DNA and cellular structure, leading to tumor cell death. So it's going to destroy the tumor cell altogether without harming the other cells around it, like the normal cells and stuff. It will pretty much, for most part, remain normal. But there's still some normal tissues that may contain PSMA, so it might target those areas too and destroy those cells, even if they're good cells, um, like in the salivary glands or kidneys, and then it may cause patients to get some dry mouth, fatigue, nausea, or low blood counts. So those are kind of things to watch out for when this medication is taken. But overall, it's a pretty interesting medication. The mechanism is pretty interesting. Um, so that was pretty much it. And if anyone has any questions, please feel free to let me know. Thank you for watching. Have a good day.